I would like to, on behalf of the Committee for Public Education, welcome everyone to our public meeting this afternoon. My name is Patrick O'Connor. I'm a teacher, member of the CFPE, and I'm going to be chairing the event this afternoon. We have organised this meeting in order to discuss the very urgent need to build a movement opposed to the reopening of the school system amidst widespread COVID-19 community transmission. Now, this, of course, is not a question that only confronts teachers, school staff and working families in Australia. This is a global issue. Despite the rollout of the vaccines that were developed through the globally coordinated and publicly funded scientific research that was developed in the last period, the situation with the global pandemic is in many respects even worse than it ever has been before. In the Northern Hemisphere, the approach of winter is now coinciding with the return of record infection numbers. Just to take a couple of examples, in Germany, this week has seen the worst spread of the virus since the beginning of the pandemic in that country. There are now daily infections higher than 50,000 in that country. The situation is, of course, even worse in the United States, which remains the global epicenter of the virus. According to the official figures, which significantly underestimate the real situation, but nevertheless, the official figures show that there have been 48 million infections, that is in the United States alone, and 780,000 deaths in that country. Another 70,000 people are forecast to die from the disease in the next few weeks. And children are among the worst affected, both within the United States and internationally. Again, there are now approximately 100,000 American children being infected every single week, representing approximately 1/4 of all new infections. Our speakers today will address many of the propaganda myths that have been promoted, namely that children are somehow unaffected by this dangerous virus. The spread of infection, which is accelerating, is driven by conscious political decisions that have been made by governments around the world on behalf of the corporate and financial elite. Lockdown restrictions and other public health measures necessary to drive down infections and ultimately to eliminate the virus have been abandoned and repudiated. The murderous policy of so-called herd immunity, or letting the virus rip, was previously publicly associated with the most extreme right-wing heads of government, Boris Johnson in Britain, Jair Bolsonaro in Brazil, and of course, Donald Trump in the United States. Now, however, this policy, this approach is that of virtually every government around the world, including here in Australia. Here, it's the entire political establishment at every level, incorporating the Labor Party, Liberal National Coalition, and the Greens, all agree with the profit-driven reopening campaign, of which the premature reopening of the schools in Victoria and New South Wales is a central and critical component. Now, in placing this public meeting in its international and historical context, it is important to register the very important working class struggles that are now emerging around the world. After decades of the trade unions suppressing virtually any form of industrial action, working class people are increasingly seeking to defend their jobs, wages, conditions, and safety through determined strike action developed in defiance of the union bureaucracies. Now, no one relying on the corporate press, either here in Australia or anywhere else, would know very much about this international strike wave. It is subject to a corporate blackout, but on the pages of the World Socialist website in the last weeks, we have had numerous reports covering the strike action of what total hundreds of thousands of workers in countries including Germany, Britain, Brazil, India, Sri Lanka, with many of these countries also experiencing significant teacher strikes as part of this upsurge. In the United States, there is likewise an increasingly fraught situation there. The deteriorating economic situation intertwining with the COVID crisis, of course, is seeing rapidly escalating costs of living, record inflation not seen for decades, which is now fueling a growing strike movement. This week alone, there's going to be 100,000 Kaiser healthcare workers going to be on strike. There is, going into its 6th week, a strike of 1,400 workers for the multinational cereal giant Kellogg's. There is also an ongoing strike of more than 10,000 workers at the John Deere agricultural and construction equipment giant. The John Deere workers have voted down twice now union proposed agreements. The first agreement, the first rotten sellout deal, they voted down by 90%. A second deal, again voted down, and workers are being determined to defend their rights in the face of a determined union campaign to isolate them, wear them down, And so the role within the John Deere strike of a rank and file committee that's been politically assisted by the World Socialist website and the Socialist Equality Party in the United States has really played a crucial role. Now here, the Committee for Public Education, the CFPE, is determined to take forward the fight here to advance the independent interests of teachers, students, and school staff. The CFPE, for those who don't know much about us, is a rank and file organisation that since its establishment has organised within public schools and tertiary education institutions, working independently of and in opposition to the Australian Education Union and other teacher unions, including the New South Wales Teachers Federation. We have opposed regressive industrial agreements that have worsened teacher conditions, especially through increasing already unimaginable workloads and also suppressed wages within the education sector. We've supported the democratic right of all educators to be able to speak out on the deteriorating conditions in their classrooms and schools. And we have campaigned against the Labor and Liberal Party's bipartisan promotion of education privatisation and campaigned for what ought to be the right of every young person to have a freely provided, universally accessible and properly resourced public education. Now, during the COVID pandemic, our work, of course, is centred on opposing every effort to have schools open up in unsafe conditions. We've issued numerous political statements and articles on the situation published on the World Socialist website. We've worked to establish rank and file committees in as many schools as we can. And we have, importantly, provided the only source of up-to-date and accurate information on the entirely predictable wave of infections that have hit the schools in the week since they were reopened in Melbourne, Sydney, and regional Victoria and New South Wales. Today we have 3 speakers. After the reports, we encourage everyone here to participate fully in the discussion. We really do want to hear from you, your experiences amid the pandemic, the situation in your school, whether you're a teacher, school worker, or parent, and of course, what you think of the political issues raised by these developments and the political issues contained within the reports that we're going to hear today. Our final 2 speakers will be Elle Chapman and Thomas Scripps. Thomas joining us from Britain. We're very pleased to have an international speaker at this meeting. I'm going to introduce those 2 speakers in more detail later. But first, we're going to hear a report from Sue Phillips. Sue is the national convener of the CFPE. She's a long-standing member of the Socialist Equality Party, a member of its national committee, and she's a regular writer on the World Socialist website, writing on different aspects of the education system here in Australia, and more recently, of course, exposing the role of the unions and the establishment political parties in keeping open the schools amidst increasingly dangerous conditions. So I'd like to welcome Sue.
Thanks, Patrick. I'd also like to welcome everyone here to this meeting, the people who have come from across Australia, but also internationally, which is really important, and a very special welcome to Thomas, who has got up very early in the morning to participate in this meeting. So we'd like to welcome everyone. And as Patrick said, we really encourage everyone to express their experiences at the moment in the schools as parents and teachers and other workers. On October the 24th, the World Socialist website and the International Workers Alliance of Rank and File Committees hosted an historic webinar titled How to End the Pandemic. The event heard testimony from scientists and workers who had advocated for the global elimination of COVID-19. The reports at the webinar explained the present state of the pandemic, how the virus spreads in aerosol form, the impact of long COVID, the role that schools play in viral transmission, and what must be done to eliminate the virus worldwide. What was made clear is that the vast majority of all global deaths from COVID-19 have been entirely preventable. Amid a new wave of mass deaths, governments worldwide are scrapping all remaining measures to slow the spread of COVID, repeating ad nauseum that society must, quote, learn to live with the virus. Countries that had limited mitigation measures in place are now lifting them all, while others that had more aggressive measures aimed at eliminating the virus are giving in to the mounting pressure to let the virus rip through society. Multiple scientists at the webinar condemned the school reopening policies, describing them as, quote, a barbaric experiment, and others as frankly criminal, pointing to schools as super spreaders, vectors of the virus. So what does it mean to live with the virus? What is the new normal? This was recently spelled out in a report from the firm McKinsey & Company, one of the leading think tanks of US capitalism. Basically, the position is, which is the policy of business everywhere, that is, reject scientific evidence that the virus can be eliminated. Such a process is too costly and is entirely incompatible with business interests. Society must adjust to mass deaths as the new normal. Everything must be assessed or measured not by the saving of lives, but solely by profit considerations. So where does the Australian government stand in all this, and how is this process expressed in the reopening of schools? And most importantly, what can be done to protect the safety and lives of educators, students, children, and the community as a whole? This week, Prime Minister Scott Morrison spoke to the Victorian Chamber of Commerce and Industry, promising the corporate elite that there will be never any more lockdowns. Fawning in the most subservient manner, he thanked them, declaring, quote, "You're the ones who manage the heartache and the complexity and the frustration of extreme lockdowns and restrictions and keeping your people COVID safe." Now, using the language of the right-wing anti-lockdown movement, he hailed the new freedoms of lifting restrictions as something that would never, ever happen again. He spelt out the government's plan going forward, and he said, this is a quote, "Can do capitalism and not don't do governments." I think that's a good motto for us to follow right across the spectrum of economic policy. We've got a bit used to governments telling us what to do over the last couple of years. I think we have to break that habit. In other words, business must have free rein. No obstacles such as COVID infections should stand in the way of profit. Now, of course, the Morrison government has never sought eradication of the virus, rejecting it in the earliest stages of the pandemic as being too costly. Nevertheless, over the past 20 months, state governments had repeatedly been compelled to institute lockdowns and other safety restrictions. This is largely the result of demands from teachers, health staff, and other sections of the working class, and out of fear that the underfunded hospital system, which is in such an appalling state, wouldn't cope with even a limited COVID outbreak. Now, due to Australia being insulated to a certain extent by our geographical isolation and border restrictions, the transmission of the virus has been repeatedly eliminated as millions of working people adhered to social distancing and made sacrifices to ensure public health. Within a short period of time, the situation has been reversed. The country went from having no cases of community transmission in early June to thousands in the following months. In previous outbreaks, government stated that it's not safe to end lockdowns before community transmission is either reduced to zero or close to it. Now the opposite is the case. The silver bullet for the reopenings, the justification for lifting borders has been vaccination, vaccination, vaccination. Now, of course, vaccinations are very important and has shown people do not get seriously ill if they are vaccinated. But the figures promoted by the government are not entirely accurate. We are being told that 82.4% of the population are double vaxxed, but that is only those that are eligible. There is a whole cohort of under 12-year-olds not counted. Last week, Morrison announced that international travel would resume in November, earlier than planned, as the spearhead of a far broadening reopening of internal borders and an array of other restrictions. Quarantining is basically to be dispensed with, as to all intents and purpose, so is contact tracing. Now, placing lives before profit is not, placing profit before lives is not just a policy of the Liberal coalition governments, but is supported by Albanese and the federal Labor as part of the National Cabinet. For a period, the state Labor government of Daniel Andrews has approached the situation slightly differently, implementing 6 lockdowns, with Melbourne known as the lockdown capital of the world. But now he is totally on board with the policy of letting it rip. In mid-September, as infection rates skyrocketed, Andrews, using language employed by Morrison, stated, quote, "We are opening up, no doubt about that. There will be no turning back. We cannot have a perpetual suppression of this virus. There will be pain. It will be challenging," end of quote. Now, to achieve this, schools must be opened as a first step in reopening the economy. Children have to be forced back on site, in-person learning in order to dragoon parents back into the workplaces. A policy driven not by medical science, but by class interests. Earlier that month, Merlino, the Education Minister, announced that VCE exams would be carried out on site as planned in early October. Now, on October the 5th, now over 5 weeks ago, the Committee for Public Education published a statement titled "Oppose the Dangerous Reopening of the Schools in Australia, Form Rank and File Action Safety Committees." That's the title of the meeting today. On the same day, we circulated a video of educators speaking out against the Victorian Labor government and the New South Wales Liberal National Government's pro-business agenda of living with the virus. That day was the first day of Term 4 in Victoria, with more than 50,000 VCE students rushed back into school for general achievement tests. Despite the total infections hitting the highest daily record of more than 1,700 that day, the exams proceeded. Now, students of primary close contacts of a positive COVID case were to sit the exams on site, but in a separate room with minimal precautions. In other cases, VCE students who were close contacts of other infected students have been given exemptions from self-quarantining to attend school. This was completely unnecessary and then led immediately to infections. A similar process has taken place in New South Wales last week, and Al is going to speak about that later in the meeting. In fact, it later emerged that Brett Sutton, the Victorian State Medical Chief Officer, had warned against the reopening of schools until 80% double vaccinated in the community. His advice was completely ignored. Now, what the CFPE warned in our statement has been sadly vindicated, with surging infections in primary, secondary, specialist developmental schools and childcare centres. In 5 weeks, more than 540 schools have been closed or partially closed in Victoria, and more than 300 in New South Wales. In these 2 states alone, more than 800 schools have become exposure sites, and we can say without doubt these figures are a complete underestimation of the real situation. None of this data is published by the government, the media, the Australian Education Union, or the New South Wales Teachers Federation, which have been entirely complicit in this dangerous experiment, not only in this recent reopening, but from the beginning of the pandemic in 2020. Together, all of them are consciously suppressing information, about how widespread the infections are because they fear growing parent and teacher opposition. For months, CFP members have been diligently tracking the closures, collating hard to access public health data, social media, and information from parents and teachers. It was only after we began exposing the alarming numbers on social media and thousands of parents and teachers began accessing and spreading the data that The Age, The Guardian, the ABC suddenly began highlighting some of the closures. The refusal of public authorities to publish comprehensive accounts of COVID-related school closures is just one expression of the extraordinary censorship that has accompanied the reopening drive. Basic public health data, including the number of infected teachers and school workers and the source of those infections, is being kept secret. Some schools have had multiple infections and closed several times in a month. Despite community infections reaching record numbers, particularly in Victoria, staggered school returns were brought forward under new guidelines that lifted previous restrictions. And of course, this same process has taken place in New South Wales too. The procedure of lifting the most basic health restrictions in schools has proceeded apace. Schools have now been assigned the task of contact tracing, not health departments, and any deep cleaning has basically been eliminated. Only teachers who have had contact with an infected individual for more than 2 hours have to quarantine. Now, this is being posed under conditions where a person can be infected with Delta within seconds. In the vast majority of schools, there is no proper ventilation, with schools having reported that ventilators are not due in schools until April next year. Instead of whole schools closing when infections take place, individual classes or cohorts are being isolated and siblings of infected children are still attending school. And principals are now left to interpret the guidelines however they like, being basically informed by the department, keep schools open no matter what. We don't want to alarm the community. Now, some teachers have reported to the CFPE infections in 6 classes or more in 1 week, but the school is still open. Others in specialist developmental schools have reported children attending class showing clear symptoms of the COVID, but not removed from the class because the school doesn't have a designated area for ill children. They've been kept in the class all day, infecting others, and then put on a bus for more than an hour to be taken home. In some regional centres of Victoria, clusters of school infections are developing. Education is now by far the worst COVID hit industry, significantly ahead of the aged care, childcare and healthcare sectors. Now, one can see on the slide that situation. The blue is the education sector, and it has far outgrown every other sector. Today, it's reported that there are 647 infections in education. There are clusters in many of the regional centres such as Corio, Morwell and Wodonga. And at the top of the list of infections is a school in Morwell Park. And this school has 55 infections out of a school population of about 400. Added to this shocking situation, the Department of Education is now trialling 15-minute rapid antigen tests in schools. These are to be carried out by the school or parents, which will mean infected students and close contacts will not need to quarantine for 2 weeks, but can be tested daily to return to school if they return a negative test. Now, the modelling of this has been carried out by the Doherty Institute, and has now been provided to the National Cabinet for consideration. Doherty reports that incursions into schools would be, quote, inevitable during rising cases of community transmission, and notes that returning students to in-person learning and keeping schools open safely has been identified as a national priority. Now, the report underlines that their major concern is not the safety of children, but how many days children might miss school due to infection, and above all else, keeping the schools open no matter what. Now, this is what normalisation means: a dangerous and potentially deadly experiment where young children and teachers are being used as guinea pigs and where lives are regarded as expendable. This photo up on the screen now is of a young girl bearing the remains of her parents and so on, or part of the remains of her family. And this is in Colombia. Similar herd immunity policies are being carried out internationally with the opening of schools. In the United States, the weekly American Association of Pediatrics report stated on Monday another 107,315 children officially tested positive for COVID. That's roughly 24% of all US cases recorded in the last week. The weekly child death toll continues to average 15 deaths per week, reaching nearly 600 reported fatalities. In the UK, and I'm sure Thomas will report on this, but up to 20,000 children are being infected every day, with a total of 108 children dying so far. Brazil, COVID is now the leading cause of death among children in Brazil, with 1,518 children aged from 10 to 19 dying from the virus in the first half of 2021. And in Indonesia, over 700 children died from COVID in July alone. Now, these figures expose the lies and misinformation by governments and media that children are not easily affected or don't spread the virus like adults, or are not at risk of serious illness and death, nor suffering long COVID. Here, growing numbers of young children are becoming infected, something that is being kept consciously from the public. A GP, a doctor in Melbourne, recently reported, in opposition to the misinformation about children not becoming seriously ill, she reported that 49 Victorian children have been admitted to ICU in this latest wave alone. 37 children were aged 10 to 19 and 12 children under 9. Now, the figures, the graph here that's gone up shows the infections that have taken place in Victoria per age. And you can see, this is since June, and you can see the orange is Victoria, and the blue is New South Wales, just to give you an idea, just to the figures. In Victoria, from 0 to 9-year-old, there have been 12,260 infections. In New South Wales, 11,000. Years 10 to 9, New South Wales, 11,000, and so on. And you can see very much the age bracket from 20 to 29, large infection rates. All of the infection rates of, below 29 far surpass all the others. Increasing infections among children has led to growing opposition amongst teachers, students and workers internationally. This is most sharply expressed in the UK school strikes that began in October, led by Lisa Diaz and other UK parents. Importantly, the same opposition is emerging here among teachers and parents who are contacting the CFPE for support, information, and a way forward. And we alone are providing teachers and parents with the opportunity, a voice to express what is happening, expose the truth, and develop and present a new perspective. This week, we posted an article providing powerful comments from teachers and parents that paint an appalling picture in the schools. And I hope our tech team can put a link to that article in the chat. I mean, we encourage everyone to read the comments from parents and teachers because they paint an extraordinary picture and expose what is actually taking place inside schools now, which the media is not covering. And hopefully some of those that we've quoted in our article are online, and we'll share their stories this afternoon. Significantly, the UK school strikes are being organised outside the teacher unions, which internationally have endorsed the murderous policies of their own governments. And here it's exactly the same. From the beginning, the teacher unions, the AU, the New South Wales Teachers Federation have unquestioningly echoed and imposed every government announcement and dictate. At the beginning of the pandemic in March 2020, when there were absolutely no safety conditions in the school, not even soap, the unions ignored resolutions and petitions from teachers to close the schools. When governments recklessly announced the ending of remote learning, the unions have welcomed it. Throughout, they've never questioned or opposed reopenings, even during growing community transmissions. In this way, their modus operandi on school reopenings is to say as little as possible, post nothing on social media about the issue, and present COVID safety as a matter for individual schools and teachers, and attempt to silence and intimidate people opposing the reopenings, above all, teacher members of the Committee for Public Education. The union bulletins have unquestioningly relayed government decisions, and when CFPE members have disagreed with the union decisions at meetings, we have been threatened with disorderly conduct to be thrown out of the meeting. Resolutions calling for the union to publish school infection data has either been ignored or teachers told that the union doesn't have time to follow up this work. Now, that's why the CFPE has fought for educators to form rank and file safety committees in every school and community, independent of the unions, to develop the widest public discussion on the dangerous situation in the schools. These committees must be based on the most accurate epidemiological and scientific research and the full release of all relevant public health data, including the number of infections in the schools and the number of clusters attributable to the schools reopening. They must be democratic organisations that bring together parents, teachers, students, and workers who can collectively develop the necessary measures to protect the health and safety of educators and students, and potentially organise industrial action and strikes in alliance with other educator and workers' rank and file committees as part of an international network. Humanity has the means to end the pandemic in a matter of months through an international strategy of elimination. But schools must be closed and non-essential businesses coupled with massive investment in testing, vaccinations, quarantining, contract tracing, and full economic support for workers whose workplaces have been closed for health reasons. This requires an assault on the wealth and power of the financial and corporate elite. Any claim that there is no money or this is not affordable is a lie. Nuclear submarines for Australia, ordered from the US as a part of the preparations for war against China, are set to cost more than $100 billion. The personal wealth of the richest 200 families has soared during the pandemic and now totals nearly $500 billion. These resources need to be redirected to public education, healthcare, and the social needs of workers. The lives of ordinary people and children can only be assured in a political fight against state and federal governments and against the capitalist profit system, fighting for a socialist system. We urge all educators, parents to contact the CFPE. That is the organising centre for the formation of safety committees. Report on the situation in your school, in your community, and alert others to the dangers, and join the discussion on the necessary collective, scientific, and international response. And above all else, if you're not a member of the SCP, then you need to seriously consider this. Decide today to join the only political party fighting for a socialist perspective.
Thanks very much, Sue, for that comprehensive report. Thank you also for those people who have been active in the chat box. Speaking next is Elle Chapman. She is a leading member of the International Youth and Students of Social Equality, which is the youth movement of the Socialist Equality Party in the Sydney area. And she's been playing an important role helping intervene amongst high school students, gathering interviews, speaking with them, learning about their experiences, and learning about the campaigns that have been increasingly initiated by senior students to oppose the school openings and to cancel or modify the HSC end of year exams. So I'd like to welcome Elle.
Thanks, Patrick. Welcome everyone to this meeting today. So I wanted to focus my remarks on the situation facing school kids and the push by governments to reopen schools and force young people and teachers back into unsafe schools. You may recall that a few months ago, in July, August of this year, a number of petitions were initiated by high school students, and these were signed by thousands of school kids, parents, and teachers in opposition to the government's plan to return teaching to face-to-face conditions by August 16. One of the petitions, which had been signed by thousands of people, was called Against Returning Year 12 Students to School During the COVID Outbreak, and it stated, "We cannot sit back and watch as the education system prioritizes our grades and our output over our well-being. The majority of staff and students will be sent back to school insufficiently vaccinated." Another petition, titled Cancel the HSC for New South Wales 2021, Find Better Alternatives, was started by student Malika Azimi and has received almost 9,000 signatures. The response of the so-called opposition, the Labor Party, as well as the trade unions to this push back to school, was to support and justify the reopenings. The aim of the government and its props in the other establishment parties and unions is to reopen the economy, and the HSC and other final exams have been used to spearhead this. Get kids back into schools, and their parents can more easily be forced into unsafe offices and factories. The government, both in this country and internationally, are fully aware that what they are doing is dangerous. We've seen, for example, that around 600 children have died in the US during the pandemic and over 100 in the United Kingdom. However, this is not a concern for those in power. Their priority is to make ever greater profits, no matter the cost in human lives. Alongside this push to get workers back into schools, governments and their backers are using the pandemic to drive down wages and conditions for workers in every industry, and this has been no different for teachers. Opposition to the impossible conditions faced by teachers and school staff is rising. One indication of this is that of the more than 50,000 teacher and school staff members in the Australian Education Union, 97% voted in favour of industrial action, with the main issue for public schools being excessive workload. A few months on from the petitions I mentioned, the opposition of young people, teachers, and parents has not simply melted away. Around the beginning of this month, an anonymous letter was posted by a Year 12 student in a HSC Facebook group with over 40,000 members. The letter detailed the difficulties faced by HSC students this year, as well as their anger towards the authorities over their response to the pandemic. The post received hundreds of reactions and many supportive and appreciative comments. The impact of the limited lockdown measures on students was described in the student's letter as follows. The lack of support from NESA and those in charge of our education, such as the Minister for Health and the whole NESA board, has frankly been unacceptable and outright impermissible. Nearly 4 months in lockdown and an extended HSC date, and we have received little to no support from those that were elected in such positions for the sole purpose of our education. The country kids in a lockdown, with little to no technology to continue sufficient learning, have suffered. The Sydney kids stuck inside and in LGAs of concern for 4 months have suffered. The Melbourne students in a 234-day lockdown have suffered. The constant changing of when we were supposed to go back to school, no graduation, severely shortened holidays, hundreds or sometimes thousands of dollars lost in cancelled schoolies and holiday bookings, no opportunity for Christmas casual employment that is usually so crucial for HSC students in getting their first job. The World Socialist website interviewed a number of high school students after this letter was published, revealing that these thoughts and feelings are indeed widespread. One student, Layla, told the WSWS, "I think the point about the inequities faced by students without access to technology, whether they have a low socioeconomic status or live in rural areas, was excellent as it was not addressed by the people who make final decisions regarding our education." Another student, Georgia, spoke about the safety concerns she had regarding school reopenings. "I do think that is a risk. In the context of school, 2 of my friends, who are both at different schools, have already had COVID outbreaks at their schools just from being back for 2 weeks. The thing is that people might say we have better immunity against COVID. But if we catch COVID, it is not just us who suffers, but our whole family. Many people will live with their grandparents or have family members who have weak or compromised immune systems." The issues raised by this student are crucial, and while younger people may not always become as sick as those who are more vulnerable, COVID-19 can certainly be a deadly disease for children and teenagers or have serious long-term consequences, especially since, as it's been raised, many of them have not been vaccinated. According to the Australian Government Department of Health website, there have been 187,000 total cases of COVID during the pandemic in Australia, and 53,583 of these have been people aged 0 to 19, which is a huge disproportionate representation of the overall total. Taking a step back from the pandemic, the dangers and issues confronting young people and workers include the drive to war, as well as climate change, and an unstable and unknown future. What jobs will young people be able to obtain upon finishing school? Will they ever be able to own their own home? Will they again be in danger from bushfires and other climate catastrophes? An anonymous student told the World Socialist website, "I've thought about asking the HSC cohort of Australia to take a stand, or the opposite, join together in unity to present a sit-in. The students could sit at their exam tables and not write anything. When time is up, we could all walk out. They have nothing to assess us on, and they can no longer compare us. If everyone did so at the first English exam, it would surely shake the country." Perhaps we need to sit in silence for our voices to be finally heard. The opposition and drive to overcome the many issues confronting young people and workers exists. However, it requires a conscious and organised political perspective. This must be independent of the official political parties, as well as of the unions, whose purpose is to shore up capitalism and assist management of workplaces to inflict further austerity on the working class. What is required are the building of rank and file committees to organise, educate and fight for the interests of the working class. Ultimately, what is needed is a socialist perspective to overthrow the capitalist system, which is the cause of the disastrous continuation of the pandemic, as well as of the drive to war and of climate disaster. And I urge you all to consider this seriously and take your part in this. Thank you.
Thanks very much, Elle. I would like to move to discussing, to introducing our final speaker. Before I do that, I would like to show a brief 2-minute long video from Britain. It's one posted by Lisa Diaz, who you saw a photo of during Sue's presentation. Lisa Diaz initiated what has become a weekly school strike action each Friday. She and other parents organised through a group in Britain called Safe Ed for All, have developed this important initiative, again, independently of the unions and the parliamentary parties. And this initiative has been fully supported by the World Socialist website and here by the Committee for Public Education. So the short video that I'm about to show you gives some sense of the discussion that's developed on social media, as well as through the WSWS.
I support School Strike 2021 because whilst the government carry on pretending that COVID is of low risk to children, that it's a benign illness, that it's okay for them to be used as vectors of transmission, in reality, children are dying of COVID. So 4 child deaths were recorded yesterday in one day alone. 4 children recorded as dead. Did we hear about it on the news? No, we didn't. What about the 108 children who have died across the course of the pandemic of COVID? Nothing. Nothing is being said at all about children dying. And, you know, I don't understand that. And of course, it's not just death, it is long COVID. We've got thousands and thousands of children living with long COVID now. Across the UK, across the world, in fact. I know children personally who have been poorly for over a year, and we're talking serious illnesses where they're being referred to cardiologists. Another boy I know who's got breathing difficulties. We don't know if they're going to get better. And yet nothing is being done to keep our children safe in school. There are no mitigations in place. And I don't think it's controversial. I don't think it is remotely controversial for me to say I do not want my child exposed to a novel virus which could kill them, which could kill me, which they could spread and could kill somebody in the community. None of this is okay. This is not normal. So, you know, if it's not a cause for action, then I really don't know what is. So that is why my children will be off school today, because I did not consent to them being used as collateral damage in a herd immunity experiment. Thank you.
That video was posted on Twitter a week ago by Lisa. Thomas Cripps is the Assistant National Secretary of the Socialist Equality Party in Britain, our sister party in Britain. Thomas joined the SEP in 2012, and he's since played a very important role in the work of our international movement, particularly in Britain and Europe. He's a regular writer for the World Socialist website on British and European political developments. He's covered, amongst other things, the outrageous pseudo-legal efforts of the American state to extradite the courageous editor of WikiLeaks, Julian Assange, who remains imprisoned in London for the so-called crime of publishing material that proved and demonstrated the criminal operations of US imperialism in the Middle East and internationally. Thomas has also written extensively on the pandemic in Britain, the associated political issues, including the infamous herd immunity policy promoted by the government of Boris Johnson. So welcome, Thomas, and thank you for joining us at this early hour. I believe you got up before 5 a.m. to mark the start of our meeting, so we're very much appreciative of that.
Well, thank you very much and to the Committee for Public Education for inviting me to speak here today. This is clearly a critical time in the pandemic for Australia, and the work of this organisation is vital to the working class's ability to organise a response. The experience of the UK, as many of you will know, and as Lisa's video, which you've just seen, indicates, provides important lessons which have been very painfully learned. The figures are stark. Just run through a few of them for you. Over 165,000 people have been killed by COVID-19 in Britain. Over 580,000 people have been hospitalised, many of them seriously, in intensive care units on ventilators. Over 1.2 million are currently suffering with the effects of long COVID, and over 420,000 of those have been dealing with symptoms for over a year. Now, the death toll includes 109 children. At the time I wrote this, I believe it's now 110. Over 69,000 children have long COVID, and more than 10,000 of those for longer than a year. And I'd like to pause right at the start for a moment to focus on long COVID, because there is an enormous propaganda effort in the right-wing media and promoted by governments to essentially deny the existence of this condition. But in fact, study after study have shown these serious long-term health effects for a significant portion of those who contract this disease, even if only quite mildly. And these affect multiple organs, most commonly the lungs, of course, but also the heart, the kidney and the brain. And they can produce a range of symptoms, from chronic fatigue to gastrointestinal pain, through to what Lisa mentioned, breathing difficulties, heart problems, even to very serious neurological issues. One study found that people recently discharged from hospital with COVID, so having survived the initial infection, were 4 times more likely than the general population to be readmitted to hospital within the next 4 months, and 8 times more likely to die than the general population in that next 4-month period on account of the damage sustained across multiple organs. Another study estimated that the cognitive impact of a COVID infection was frequently comparable to that of lead poisoning, and in the worst cases, worse than that of a stroke. The burden of death and disease that has been thrown onto the working class is truly staggering. And of course, this has not been some unavoidable disaster, but the outcome of conscious policy choices. The government adopted a herd immunity strategy, as has been said, at the start of the pandemic, which it knew, it was told, would lead to hundreds of thousands of deaths. It was only forced into lockdowns, which were of a limited character, by the mass anger in the population when these plans were exposed. Prime Minister Boris Johnson's attitude to the working class was revealed by his former chief advisor earlier this year, who said that Johnson had screamed in frustration in October 2020, and here, please excuse the language, "No more fucking lockdowns, let the bodies pile high in their thousands." Well, the bodies did then pile up, and as of this summer, not only lockdowns, but any public health restrictions to speak of have been ended. Which brings us to the situation that we have now. With the exception of a 3-week period in the height of summer, the daily average number of new cases in the UK has been above 30,000 since so-called Freedom Day. That was the ending of practically all public health measures on July 19th. In reality, these are officially recorded infections. In reality, based on other surveys, that figure is probably more in the region of 70,000 infections a day. And the highest infection rates in this time have been among school children. At one point, infection surveys showed that 1 in every 14 secondary school pupils had COVID-19, and 1 in every 36 primary school pupils. And the virus carried by these children has already demonstrably begun to move into the older parent age sections of the population, and from there into older layers and more vulnerable layers. Again, this is a deliberate policy. The government sent children back to school en masse without any vaccination in place among them whatsoever. An advisory document to the government ahead of the school reopenings noted that the absence of vaccination among children and stated, and this was bolded in the document, as a result, herd immunity is not reached without a large resurgence of transmission. That is, this was entirely foreseen and planned for. And when the expected surge was produced, every government minister and every government associate insisted, and they continue to do so, that there will be no return to lockdowns or even the most elementary public health restrictions in schools or anywhere else. This Monday, the Education Secretary, Nadhim Zahawi, summed up the government's plans when he said, "Ultimately, our plan, we will, I hope, be the first major economy to transition from pandemic to endemic and have an annual vaccination program." To state that agenda more bluntly, the UK is hurrying to normalise death and serious illness due to COVID, and they are racing other governments to do so to secure an economic advantage for the super rich. In this context, vaccination is not seen as a means to the suppression and elimination of the virus, but as little more than a propaganda device to justify abandoning all other measures. Now, what does allowing the virus to circulate in such high numbers look like in practice? Since Freedom Day in July, over 13,200 people have been killed by COVID-19, and that translates into a rate of roughly 43,000 people a year. Somewhere between 100,000 and 200,000 people develop long COVID in this period. And that's all before the winter months. The UK is entering winter with the NHS, National Health Service, in a state of near collapse. Every ambulance service in the country is on the highest state of alert, with average wait times having doubled since 2019. Hospitals are as full as they normally are at the peak of winter. And accident and emergency units are so overwhelmed that patients are being forced to wait hours in queued up ambulances outside hospitals. At the same time, for the oldest sections of society who had their second vaccine jabs very long ago now, immunity is beginning to wane. Over 2,000 double jabbed over 70-year-olds were killed by the virus in October alone. Now, millions of people have been asking themselves throughout this pandemic, how was and is such an enormous crime possible? And that is the central question, because only by answering that can the working class take up a fight to bring this crisis to an end and to hold those responsible for it to account. In the UK, Prime Minister Boris Johnson and his government have been able to carry out their policy of social murder in the face of mass opposition, thanks above all to the Labour Party and the trade unions. On schools, Labour leader Sir Keir Starmer sent a confidential letter to Johnson last May, offering his help to, quote, build a consensus for getting children back into our schools. That August, Starmer published an opinion piece where he declared, quote, let me send a clear message to the Prime Minister. I don't just want all children back at school next month, I expect them back at school. No ifs, no buts, no equivocation. And this has been his policy ever since. The task of squashing resistance among school workers was handed to the education trade unions, who did not call a single strike action over the dangers of the pandemic, actually voting against one explicitly last November as cases in schools were surging, and who allowed educators who did speak up with safety concerns to be victimised. The unions have continually appealed to the government to work with them in keeping schools open under the cover of entirely inadequate mitigation measures. And they've put themselves at the forefront of the opposition to educational disruption, the entirely cynical rallying cry of the right-wing opposition to school closures. Now, this has, of course, generated substantial opposition in the working class and among the trade unions' own memberships, most clearly expressed in recent months by the Friday school strikes called by Lisa Diaz, which have been referred to. Now, we, the Socialist Equality Party and the World Socialist website, have lent these actions every possible support. As the World Socialist website editorial board explained at the time of the first strike on October 1st, the initiative was significant in three key respects. We said first, it articulates the strivings of the working class for a policy based on saving lives, not profits. Second, the action has been organised independently of the unions, which have at every point worked to implement the homicidal policies of the ruling class. And third, the initiative is developing as an international movement. Now, these aspects point the way to the sort of struggle that has to be taken up in the working class. There is a developing break with the trade unions and the Labour Party or its international equivalents, which must be encouraged, but it must also be developed. It is necessary, but not sufficient, to simply reject these thoroughly rotten organisations. The rebellion against the betrayals of the trade unions is sustainable to the degree that something fundamentally new is constructed in their place. And that is the significance of the rank and file committees of educators, transport workers, manufacturing workers, and others that we have begun to establish internationally. These committees, by freeing workers from the unions and giving them the ability to organise internationally in defence of their own independent class interests, create the basis for a genuine struggle against the pandemic involving all the necessary measures, the closure of unsafe schools and workplaces, and provision of high quality online learning, the enforcing of rigorous public health measures, financial support for those required to stay away from work or to self-isolate, and above all, a political fight for the resources required to eliminate COVID-19 for good. Such a struggle is becoming more urgent all over the world as the majority of the global population enters winter, with global vaccination levels at just 40%, and with countries which previously pursued a zero or low COVID policy, turning to mass infection and living, or rather dying, with the virus. Just to underline the seriousness of the situation, I wanted to conclude by broadening the focus to look at the European continent, which is once again at the center of the pandemic. For context, Europe is still, I believe, the most fully vaccinated continent in the world at this point. And yet, since mid-September, daily cases have more than doubled, and they will soon outstrip their previous highest ever peak. Many countries in Central and Eastern Europe are now experiencing their worst waves of infection and death since the pandemic began. Patrick, at the beginning of this meeting, referred to Germany, the fourth largest economy in the world, whose daily cases, average of daily cases, passed 50,000 this week, and the increase shows no signs of slowing. One of Germany's leading virologists, Christian Drosten, warned on Wednesday that at this rate, Germany could see another 100,000 deaths. And even before this prediction, the World Health Organization had warned that Europe could be facing another 500,000 deaths in just the next 3 months. Now, Australia has, of course, had a different experience of the pandemic to this point, or until very recently. But as the previous speakers have said, that will change and is changing, thanks to the policies there of the Morrison government. The lesson of the UK, as everywhere else, is that the consequences are grave, and that only the independent political intervention of the working class can avert a catastrophe. So if I may, I'd like to end by encouraging everyone who is not already doing so to involve themselves in whatever way they can in the work of this committee and of the Socialist Equality Party in Australia. Thank you very much.
Thank you, Thomas, for that really important report detailing the situation in Britain and Europe. Taken together, we've had a lot of information presented to this meeting, a lot of important information, and there has also been a pretty lively use of the chat box, which we welcome. We are now in the discussion part of the meeting, so I welcome discussion, questions. There are already some questions being put in the chat box that I believe Sue wishes to speak to. So while she's speaking, others can think about whether they wish to raise your hand or use the chat box to indicate a question. Thanks.
Yeah, thanks, Patrick. Yeah, thank you for all the questions and comments that are coming in. And yeah, I'd like to sort of underline what Patrick has said too. We want to encourage teachers and parents to speak about their situation, because in speaking about it, it really exposes the sort of dangerous consequences of the reopening. It's not just data, but it has an impact on people's lives. Human beings are being impacted on. Jessica made a comment about, it's gone back in the chat, but she made a comment about her situation where her 7-year-old came home from school and has now infected the family. It's going through the family. And which is just terrible situation, right down, I think, to, she has a 2-year-old. And she makes the point at the end, you know, we're basically being told that it's inevitable. And we under the present conditions where schools are opening, where kids are getting infected at school and bringing it home, it is inevitable. But what we're saying is that there is an alternative to this. It doesn't have to be accepted, you know, as lots of parents have said, you know, children, you know, why are we going back to school now? There's only 5 weeks left of school. Why can't kids be back? Remote learning, there's the school holidays and so on. The position that we're fighting for is that a policy of elimination has to be fought for. And that requires not only the expertise of scientists, but it requires the mobilisation of the working class, the establishment of independent rank and file committees. Now, one of the other things that has come up in the chat that I'd, you know, just like to address, someone has asked about, you know, can we sort of take on the government legally? Is there a petition I can sign, you know, and so on. And, you know, that COVID is a social problem. It's a health problem. It's a social problem. It's not an individual problem. And it requires a social response. It requires the working class to respond to this situation. And petitions at this point in time to the New South Wales government, Morrison government, Andrews government is a complete waste of time. Because you are petitioning the people, the very organisations that are carrying out these dangerous, deadly, murderous policies of opening up the schools. And at the webinar that was held on October the 24th, one of the scientists there spoke, and I just want to read what he said, and we reported what he said. And he said, and his name is Dr. Eric Feigl-Ding. He's an epidemiologist, a health economist, and senior fellow at the Federation of American Scientists. And he said, you know, this is just what he said about the pandemic and the response of governments. And he said, the moral backbone of public health has been completely broken by politics. He said, the days of petitions and op-eds in the newspapers are over. We clearly know that the political powers that want to reopen, let it spread, let it rip, mass infection, live with the virus, clearly don't care about all the scientific rationale whatsoever. So this is a scientist, you know, which aren't clearly known for their political activity and so on, has come to the conclusion that the days of sort of, you know, petitioning the government are now completely over. You know, it requires a movement, a mass international movement to fight for elimination. And it's only the working class that are going to do that. It's not, you know, we can't see this as some sort of individual problem. Just finally, on another point that was said at that webinar by David North, who's the chairperson of the International Editorial Board of the World Socialist website, he said this was after all the evidence was presented, and he said the problem is governments don't listen to scientists, they listen to bankers, and that's the problem and situation that we confront. So, you know, that's why we're saying to, you know, everyone that's here that, you know, the most important decision is to be, you know, join the Committee for Public Education, participate in a rank and file committee, you know, broaden and widen the struggle that has to be taken forward in the working class, in the community for a policy of closing the schools and elimination.
Thanks, Sue. I see one hand up. The account name is R&A Pass. Do you wish to unmute and speak? I believe you're able to, if you can find the mute button. Tech team, is there a problem with that, or? While we're waiting on that one, if there's anybody else who wishes to speak, then you can raise your hand. If you can't find the raise hand button, please just indicate in the chat box that you wish to speak. Again, that is teachers, school workers, parents. We would very much appreciate being able to hear from people what your experiences are, what's been happening in your schools and communities.
Yeah, thank you, Patrick. Hi, everyone. Thank you for the very detailed report so far. I may repeat some of the things that I've said. I'll try and be brief, but I'm really hoping to just help to highlight one of the very important parts of our work, and that is the collecting of data and reporting it. The CFPE started collecting school closure data back in mid-August, as we noticed that schools were being affected, despite the fact that it was during the so-called hard lockdown. So schools were only open to vulnerable kids and essential workers, so very limited numbers. At this stage, we basically had a suppression strategy being carried out in Victoria. I'm speaking about. Schools were closed when even small numbers were detected. And the education department were listing the public schools that were closed on their website. So at that time, it was relatively easy for us to gather school names and actually count how many schools were being affected, although independent schools were not being counted in this way.
Mandy, we're getting a bit of scratching feedback type sound. Can you know what that is?
No, I'm sorry, I'm not sure.
Sorry, go ahead, sorry.
Is it still an issue?
Don't hear it now, go ahead.
Not sure. Okay, sorry about that. So yeah, and I note that the independent sector weren't reporting any of their schools that were affected either. So a few times a week at this stage, we were posting our data, posting the numbers of schools that were closed. And this was beginning to be noticed. People were wanting this information and they weren't getting it from other places. Some people were confused, saying, well, I thought schools were closed. So we played an important role in clarifying this, that they were open, just to limited numbers. We began posting daily numbers and soon, following requests from people, we started adding lists of known schools on any given day. By the end of term 3, which was 5 weeks that we'd been counting, there were 95 schools that had been closed under these conditions of limited numbers. No one else was collecting this information, and certainly no one was reporting it. People were beginning to tell us of other schools that weren't on our lists. And so in term 4, we started listing weekly data of whole lists of schools that we'd collected or that people had let us know. At the end of week 1 in term 4, there were 22 schools that had been affected. End of week 2, we had 100 more added to that tally. We started putting call outs to people to let us know if there were schools that we'd missed, which was taken up quite significantly. At this time, we started noticing community pages on Facebook that were also starting to express concern and start reporting exposures, because there was less, less exposures. Tier 1, places were not being reported by the government. And again, it was really clear that people wanted to know this information. By week 3, we had another 141 schools that were affected and added to our tally. This was around about the time when the suppression policy was effectively dumped. Schools began returning to face-to-face learning full time, even though numbers were rising. We were hitting, quite hot, our highest daily numbers of infections. The return to school kept being pushed forward, which was really kind of a competition with New South Wales to see who could open up the quickest. But now the rules were changing and schools were not closing anymore. As people have commented in the chat, school, only classrooms were sent home when there were cases, or cohorts were being sent home. So this meant that the government stopped reporting closed schools. So it made it much harder for us to collect our data. However, we persisted. CFPE members were then scouring Facebook pages and collecting information from emails and messages from concerned parents and teachers that were letting us know of their personal circumstances. This was around about the time when CFPE members spoke at union meetings asking, would the school collect this information? Would the union collect and report this information? And we were told no, they didn't have time to do that. The media was silent at this time as well. By the end of week 4, we had another 119 schools added. The end of week 5, there was another 73. And we believe that drop was due to the reporting by the government, not because it was any better. By the end of this week, week 6, another 88 schools were added. So that's a total of 543 schools in Victoria alone affected in just 6 weeks. New South Wales, following a similar pattern, collecting schools in a similar way, they have hit 301 schools affected. We're well aware that this is probably well under the real figure due to how hard it is to collect the information. We've been posting this work on Twitter and on Facebook, and we're noticing that our work is being retweeted quite a lot, and lots of comments and lots of information, again, just highlighting the fact that people need to know this, and people want to know the extent that's happening so that people can make informed choices about their own kids, sending them to school. Sorry, I've lost my train. So really the government's quite deliberately suppressing this information. They're normalising high case numbers and normalising death, which has been talked about already. The reporting of hospitalisations, for example, it's being skewed because they're changing the rules. I've heard that people who are hospitalised due to COVID, even on ventilators due to the aftermath of their infection, they are no longer infectious, so they don't report them as being hospitalised because of COVID, even though that's exactly why they're there. So the numbers look better. The cluster data, which again has been commented on in our chat, yes, it's being reported current numbers, but when people recover, those numbers are removed from the list. So it's not really giving a true indication of how many are affected from that cluster, for example, so it's only the current number. It's not capturing the peaks, which the CFPE has started doing, and will report shortly on those peaks, and we'll continue to monitor and report those as well. Making the data hard to find is really minimising people's understanding, so they will feel safe to march their kids back into unsafe schools and to get back to work to support the corporate and government profits. We're seeing rules continuing to change. Rapid antigen testing is coming in now, not because it's safer for kids, but because it will get them back to school quicker. We know that the testing is only 70% accurate, and that the government's basically relying on parents to do it and to accurately let schools know if there is a negative result. Clearly, there's going to be issues with that. There's no real detail in the numbers, and I think that helps. I know that helps to sell the mantra that schools are safe. they know as well as we know that it's not. We've got a lot of people here in the meeting that have reported their schools, and we call on people to please continue to do that so we can be as accurate as we can in our reporting and to continue to share their stories. Thanks for that.
I'd encourage everyone here, if you haven't already, to leave your contact details with the Committee for Public Education. You can find us on social media, on Facebook, Twitter, etc. If you don't use social media, then I'd encourage you to plug in your email address and phone number in the chat box. You can direct that, instead of being to everybody, you can send that to hosts and panelists, because this discussion is not the end of the campaign, obviously. It's about taking this forward, developing the work of the rank and file committees, extending the work of these safety committees in schools throughout Victoria, New South Wales, and more broadly. We do have several important comments that have been put in the chat box, reports from different parts of Australia, for example, from Shepparton and regional Victoria. Many of the regional working class centres are now at the forefront of the school infection clusters. I would encourage anybody logging into the meeting from Shepparton who wishes to speak to please indicate. We also had a couple of important comments that I'm just going to read out before I call on the next person who's indicated. Sorry, let me just find it. We had Natalie from COVID Safe Schools thanking us for the seminar. You're welcome. Thank you for participating. Shane Davies, an important comment there. I'm a secondary school teacher. We've had 3 positive cases attend our school since we reopened. We have no ventilation systems. We can't even open windows in many of our rooms and have no air conditioning systems. We are not doing temperature testing, and there are so many noses hanging out of masks from both staff and students that it's impossible to enforce mask rules. We've not had deep cleaning and barely have normal cleaning because of the time restraints for our cleaning contractors. Many students are staying home either as close contacts or by choice. Some of our teachers have decided not to come back this year. So thank you for that comment. The issue of air purification is really important. I mean, here in Victoria, the government boasted for weeks they were going to purchase, I think it was 51,000 air purification systems. I believe something in the order of 4% of those have actually been delivered. There's numbers of schools that haven't got a single one, even when all 50,000 to 50,000 are delivered. That's not going to be one per classroom. That'll be maybe one for the staff room, maybe one for the sick bay, and that's about it. And so the issue of air circulation is really crucial. The neglect on that front reflects the broader neglect of the public education system. Cheryl Crisp has indicated to speak. Cheryl, for those who don't know, is the National Secretary of the Socialist Equality Party. She's a regular writer for the World Socialist website, has been following the COVID situation here in Australia very closely, and played a really leading role in developing our analysis on this pandemic and the necessary moves to stop it. So I welcome Cheryl.
Thanks, Patrick. Look, I just wanted to follow on from some of the points that Mandy raised, because I think her contribution and the outline of what it takes for the CFPE and the efforts that are required to accumulate and post the information that is done so on school closures. This is not, as she has outlined, a automatic, easy process which results in the posting. It is the result of determined, intransigent, ongoing efforts by all the members of the CFPE and in the Socialist Equality Party to produce this information. Now, the CFPE is certainly made up of dedicated, committed teachers, parents, and others, but it certainly does not have the mechanism, the resources at its disposal that the media, the unions, the health department, the governments, and others have. So the question I think needs to be asked, why is it that this information, so crucial to the knowledge and the ability of parents, of teachers to make informed decisions, why is it the province of the CFPE to provide it for ordinary people? And as Patrick has alluded to, I mean, the chat in this meeting is very difficult to follow because there's so many comments being posted, parents and teachers discussing with each other, learning about their experiences, clearly feeling that you know, you have established a connection with like-minded and like experiences, you know, throughout the country. So why is it that the unions, the Labor Party, these organisations that have at their disposal millions and millions of dollars, whole phalanxes of individuals and resources with which they can access this information, why is it that you are not able to access it outside of the CFPE? And the reason is because the information which is being provided provides ordinary people with the knowledge, the truth about what is being faced. And I think that the speakers today who have outlined in different spheres, Thomas in Britain and in Europe, Sue in regards to Australia, Elle with younger people, this is not information which is available through the normal mechanisms of society. And the reason that is because they oppose, the political elite oppose ordinary people having information. I mean, why else is Julian Assange sitting in Belmarsh prison fighting extradition to the United States, where he will face the possibility of 175 years in jail because he provided information about the war crimes of the United States, of Australia, and other countries to ordinary people. And so I think that's one of the elements, one of the major issues that I would acknowledge or I would raise, that people in this meeting think about. Why Sue and others have raised the question of forming rank and file committees, because the experience that you're having is not just an Australian phenomena, or even one that pertains just to the schools. Certainly in the United States, our party has encouraged the formation of rank and file committees amongst auto workers, amongst health workers, all of whom are finding that in order to know what a contract is that is being put forward by the unions, they have to form an independent committee in order to know what it is that they're voting for. Because the information, which is a revolutionary force, information, knowledge, the truth, is a revolutionary question. Because without it, people are completely blind. They face this situation. And I think that the experience that Jessica has outlined, which is not just heartbreaking, but criminal, that a family and Jessica's experience is one which is being repeated in the millions throughout the world. Because while, of course, the official death rate for COVID-19 is now over 5 million, in fact, the estimated death rate based upon excess deaths is something closer to 16 million. Now that is on a par with the death death toll of World War I. That's what we are facing now. In 2020, it was the elderly that was sacrificed. It was the elderly, you know, our parents, grandparents who died. 2021, it is now children. And that's what the demand for reopening the schools is in fact bound up with. The most vulnerable, certainly in regards to the pandemic, because these kids are entirely unvaccinated. The most vulnerable sections of the population are now being forced back into unsafe vectors for a virus, which not only could infect young people at a rate which has not been seen before, and in fact, this year, one of the elements of the infection, certainly in Australia, but again, as Thomas outlined it in Britain, is that it is increasingly young children who are being infected. In Victoria and in New South Wales, half of the infections are under 19. Now, that is under conditions in which no one up until the age of 12 can get a vaccine. And what our movement has fought to draw out, and I would very much encourage everybody in this meeting to read the interview that the World Socialist website did with Dr. Leonardi, who is a T-cell immunologist who has studied at Johns Hopkins University in the United States. And he has co-authored with Dr. Gurdasani, an epidemiologist, a paper outlining what the impact is of long COVID on children. And if you want to know why you don't get this information, it is because this is an illness that could condemn little children, young children, to a lifetime of debilitating conditions. Certainly it is just, COVID-19 is described as a respiratory syndrome, but in fact, it affects the entire immune system, and including the lungs, the heart, kidneys, central nervous system, liver, adrenal glands, bone marrow, lymph nodes, gastrointestinal tracts, and also the brain. In fact, tests and studies which are now being carried out on monkeys have shown that, in fact, the impact of long COVID, even with people who have only suffered minor, mild forms of COVID itself, reproduce or create what is called Lewy bodies. And Lewy bodies are a precursor for Parkinson's disease and dementia. And so what is being created here, knowingly, consciously, by capitalist governments, is the possible condemnation of an entire generation of children to the most debilitating conditions that they would not normally have suffered until their 70s, 80s, or 90s. And so what is being raised here, the conditions that are being imposed upon the working class on an international scale, and increasingly, while obviously different countries have different experiences, but increasingly it is an international experience. And it is akin to war in that sense. It is a war on society, because what capitalism is determining is that nothing is going to impose an imposition on the development of production and profit. And that's why the schools have to open. The schools are opening not because governments are worried about the education of children, not because they're worried about the mental health of children, but because their parents have got to be driven back into factories and workplaces. And so this is what now confronts billions of people on an international scale. And if parents and teachers are feeling alone, are feeling that they're dealing with this as individuals, it's because that's what's been imposed upon you by the unions, by the Labor Party, and by governments. And that's why it is so important that out of this meeting, you know, you make the decision to sign up for the rank and file committee to enable the sort of collaboration, discussion, interaction of experiences, knowledge, information that you are being denied at the moment. And so I think, you know, what has been raised by the speakers and also by the chat, by your experiences, raises so profoundly the necessity for you to take independent action outside of the constraints and the grip of the unions and the government.
Thanks very much, Cheryl, for those comments, which are really important. We do have more time for discussion. We're going to conclude the meeting later with a couple of announcements that I've got, but before then, I should have emphasised previously that any questions to Thomas Scripps are very welcome on the situation in Britain or Europe. We do have one question which I'll put to you, Thomas, to answer in a few minutes if you don't mind. Sorry, just scrolling up. The question is, could you explain the evolution of how Lisa Diaz came to call for school strikes and what is she doing now? Thanks. So we'll take the answer to that question in one moment. There is also another question for Thomas, which I'll read out. Thomas, I was wondering two things. How is it that Lisa can be working with the World Socialist website? And what has been the response to the call for school strikes?
Yes, of course. I'll try and be concise. I know we've got a number of people who would like to speak. The question was how the school strike initiative developed, the role that the World Socialist website played in it, where it's at now, what response it got. Lisa is a parent. She describes herself, has done to us, as someone who was not especially political up until the pandemic, but who was confronted with the extreme risk posed to her two children and to herself. She has a health condition that means she's more vulnerable, obviously, to her friends and colleagues, and decided, as she says in the video, that this was not acceptable, that this is not normal, and that a fight had to be taken up against it. She set up a group called Safe Ed for All, Safe Education for All, which did an awful lot of the work, an awful lot of similar work to what's been described here, conducted by the Committee for Public Education in terms of tracking outbreaks in schools. This isn't done anywhere. It's not done by a government organisation. It's not done at all in the media. In terms of registering in the early stages, the spread of long COVID in children, deaths among children, which again were completely absent from the media, at least buried very deep in government reports when they finally were presented or reported. Also tracking the number of deaths of school workers. This is something the unions have not done throughout the pandemic. The government gave updates on a sort of 6-monthly basis. It's now been discontinued. I mean, the last one, so from 6 months ago, I think longer, actually had it at 570 school workers who had been killed by this virus. No comment on that by the trade unions throughout, no effort to track it as it was taking place. Safe Ed for All did an awful lot of that work, and they, in the absence of any other initiatives, they also tried really every conceivable form of political pressure to try and force a change in policy. They spoke with local councillors, with local members of parliament, with trade union officials, with the Labour Party, and of course got nowhere. They actually achieved a meeting with Labour's, the Shadow Education Secretary, who promised all sorts of things in a private meeting, and then Safe Ed for All sent them an email afterwards saying, thank you so much for your support. We'd like to issue a press statement that says we've had this meeting and that you've supported our positions, and so on and so forth. And they got a very quick reply back from Labour's Shadow Education Secretary saying, these meetings were always held in confidence. We're very surprised you'd ever suggest publicising this. And in any case, we never reached formal agreement on any of these points. That's a pretty good summary of the way that they were treated. They've had a number of Twitter exchanges with leading figures in the National Education Union who have been opposing strike action, asking, and the leader of the National Education Union asked, well, what would we even be striking for? What would we base it on? How would we support our members throughout this strike, so on and so, what would be the support? And as we in Safe Ed for All answered, well, the reason is for the safety of your members and also the health of the children in your care. The way you can support it is through the multi-million pounds of reserves owned by the union, several £100,000 of which are given to the annual salaries of the union's leading officials. And who would support it? Well, if the petitions of their own members throughout the pandemic are anything to go by, indicating massive support for safe schools, then the vast majority of them. So they've went through a lot of experiences with all of these organisations which are nominally left and oppositional, and discovered they were nothing of the sort. At around that stage, they came into collaboration with our educators' rank and file safety committee, which was also doing a lot of similar work, trying to mobilise teachers, school workers, workers more broadly around the issue of safe schools. We publicised interviews with, published interviews with a lot of their members, gave a lot of the investigative work they were doing a larger circulation, and we also engaged in a political discussion about the way forward. Out of that, Lisa, on her own initiative, decided she wasn't waiting anymore for Labour or the unions, and that she was going to take action. And that's when the call for the October 1st school strike developed. As I say, we gave that all the support we could. The World Socialist website set up. Obviously, this is due to the nature of the pandemic, a school strike, a stay-at-home school strike didn't have much physical presence. So the World Socialist website set up an online picket line to which people could post videos, some of which you saw, or pictures, some of which you saw at the start of this meeting, indicating their support. That support was very broad. I think every continent bar Antarctica was represented. With people sending in messages of support, videos of support as well, explaining their experiences of the pandemic. It had a major impact in drawing out the opposition that does exist to the policies of governments over the pandemic, and particularly in the case of schools. Where it stands now is that she is continuing to hold these school strikes every Friday, and we're engaged in discussions. She and other members of Safe Ed for All are engaged in discussions with our Educators Rank and File Safety Committee about the next stage, because the protests are hugely important as an expression of the opposition that exists, as something that inspires and mobilizes the sentiment, the oppositional sentiment that exists among broad layers. But what going forward, what needs to develop, of course, is a movement that can actually take control of the response to the pandemic, bring it into its own hands, and actually carry out the necessary measures that are required to keep people safe, school closures, proper testing, and all the rest of it. So it's at that stage now. We're discussing its development into a broader movement, which of course requires a major political struggle. And just on that point, we've stressed, the Socialist Equality Party has stressed throughout the pandemic, that the virus doesn't attack individuals, it attacks society. It therefore overwhelms by the laws of viral transmission, by the laws of life in modern society, attempts at an individual response. The response and the impact of the virus is determined by the response of society as a whole. And that in itself is defined by one or the other class interest. Currently, it is being determined by the interest of the capitalist class on the basis of profits over lives. That profits have to continue circulating, and give or take, therefore the virus has to continue circulating, and no one who matters very much will die anyway. That's the approach that's being taken. That has to be replaced with a different social response, one under the control of the working class, which doesn't have an interest in maintaining the profits of the super rich, but has every interest in maintaining safe working environments, its own health and lives. And I think, people who've spoken about feeling somewhat isolated, about the feasibility of an elimination program, these are all understandable concerns, especially in the given conditions, but conditions change dramatically when a political lead is given. People respond one way, and certain things seem possible when the overwhelming propaganda is that nothing can be done about the virus now, where COVID is endemic, we're required to live with it, when platform is given to right-wing and far-right forces to insist on homicidal herd immunity type policies, when the unions critically suppress any attempt at an opposition in favour of safe schools. That creates certain conditions, but in the presence of a political fight, the sort of fight that this committee will wage and that the Social Equality Party is waging in all the countries where it's active, you bring out the opposed response, and that sentiment, we know everywhere we speak to people, does exist, and you begin to change the conditions, you begin to fight back, to push back against the right-wing narratives and politics that is currently being given its head, and you break out of this sort of false isolation that's imposed by the so-called unions, as we say. That word is entirely a misnomer. And I think when you start to see that movement develop, you will start to see, as I indicated in my speech, the basis for an entirely possible, scientifically, program of elimination and mobilize people in its support. So the school strikes are an expression of that process at a very initial stage, and the work of our committee in the UK, and of course our committees internationally, is to develop it to the next stage and to begin bringing the working class into the fight to enforce its own response to the pandemic.
Thanks very much, Thomas. That's really important issues that you just dealt with there. I'd like to call next Amanjit, if Amanjit can be allowed to unmute herself.
Okay, so the contribution I wanted to make to the discussion was from a slightly different angle, which is that of, I guess, an engineering angle. So the reason why AusSage is a bit different to some of the other sort of organisations that are putting out COVID sort of advice and guidance is because AusSage actually prioritises the precautionary principle above all others. Now, for those of you who are not scientists or engineers, the precautionary principle is basically something that underpins just about anything to do with public health and safety in society. So what it involves is setting very strict limits on things. So for example, you see the precautionary principle at play when the EPA sort of mandates very strict concentrations of pollutants in the air. You see the precautionary principle when pregnant women don't eat runny eggs, even though there's basically no chance of anything happening to you when you eat runny eggs. But when I was pregnant, I didn't eat runny eggs. You see it at play when you insure your house against a fire. even though you are in a concrete jungle and there's no way your house is ever going to burn down. You see it in play when you take out life insurance, or when you take out hospital cover or health insurance against conditions that you are unlikely to ever experience. And yes, someone's written in the comments, yes, Natalie's written that, you know, it's better to be safe than sorry. And that is basically the precautionary principle in a nutshell. Now, the precautionary principle, if you were to apply it to a school that has been opened, would involve multiple layers of protection. You know, people use the Swiss cheese analogy to describe protecting against COVID, because no single measure is 100% effective. So you use lots of measures stacked on top of each other. Now, us adults, we've got, you know, a lot of us work in, you know, air-conditioned buildings, or, you know, sort of well-ventilated buildings. We have a mask mandate indoors here in Victoria. We are vaccinated. So, you know, nearly all of us adults are vaccinated. So we've got, you know, social distancing, vaccination, ventilation, and masks. Now, with children who are very small in Victoria, so prep to grade 2, they are not required to wear masks. So the sort of the lack of a mask mandate for the littler kids, in combination with poor ventilation, which I can attest to, having been a high school teacher. So there's the lack of a mask mandate, poor ventilation, no social distancing, and no vaccination for little kids. So when you combine all of those things, basically the precautionary principle is being ignored for so it's like for basically just this group in society. Every other group in society, all of us adults, have the precautionary principle in play, because if you're vaccinated and you're wearing a mask and all that, then you've got that Swiss cheese layers of protection. Now, little kids, prep to grade 2, they have no protections at all. And basically what we're doing is we're gambling on their immune systems as the only layer of protection. Now, this is akin to a soccer, like this is sort of analogous to a soccer match. So anyone who's watched sort of high level sort of European soccer or anything will know that if a sudden goal kick, so if a sudden sort of kick or attempt at goal, you know, is observed, and the goalkeeper sort of manages to head it off and save the goal, what you'll see him do is yell at his defenders. Okay, so because the ball should never get to the goalkeeper in the first place, it should go to the defenders. Now, the defensive line is ventilation, vaccination, masks, and social distancing. What we are doing with our little kids is we are basically removing the entire defensive line and letting the ball go straight to the keeper, which is their immune systems. And that's the problem that I have with schools reopening in the way that they are. Now, I think that it may be possible for schools to open more safely than they are, but that is not happening. And I've literally done the calculations to confirm this for myself. Now, I did an engineering degree like a million years ago, and I can't say I was very good at it, but I know enough that I can actually read literature and read, you know, sort of documents and figure all this stuff out. And I've done all the calculations. I've actually done the same calculations that the New South Wales government did, but they did it incorrectly. But I did it correctly. Because what they've done is they've misapplied the calculations they've used to justify a reliance on solely natural ventilation. Now, I've done it correctly, and the typical classroom that they sort of have modelled will not have enough air changes per hour to reduce transmission of COVID in schools. Now, I would wager that the situation is the same in Victoria. I can confirm that as a high school teacher, anything sort of even below 30 degrees It's hot, it's stuffy, and it stinks. And if you've got sort of bad body odors from teenage boys building up in a classroom, then that's a sign you've got poor ventilation and poor air quality. Now, the reason why ventilation is absolutely necessary, it's not just some kind of, oh, we need fresh air. It's basically to do with the concentration of virus aerosols. If you have...
Manjit, I'm sorry to interrupt you. What you're saying is important. I'm just mindful of the time though, and there is at least one other person that I want to get to, so I'm sorry.
Oh, yes. Oh, no, that's okay. I've made the point which I really wanted to make, which is all about the precautionary principle and how important that is. So I'm happy. So thank you very much.
Thank you. Thank you for doing that. The issue of the precautionary principle was also raised by Michael Baker, who's a medical expert in New Zealand, who was part of our international panel, which everybody here should really watch that lengthy presentation that we developed, chaired by, there's the presentation there, chaired by David North, who's the international editor of the World Socialist website, but featuring, well, Lisa D, as we've seen from, also David O'Sullivan, who's a victimised bus driver in London, but then the other panelists all being medical experts, renowned figures in their field. Michael Baker made the point regarding the precautionary principle that we simply don't know what the long-term impact of long COVID is, as has been raised by Thomas and Sue. Therefore, every effort must be made to prevent children from being exposed to this virus. That is a fundamental reason why the schools need to be kept closed during community transmission. We'll have a little bit more discussion before we wrap up. Will?
Hi, everyone. Yeah, I'd like to thank the speakers. It's been a very important meeting. Just wanted to deal with some of the issues that have been raised, particularly with CO2 monitors, and also, I guess, with the last some of what Amanjit said, because as Thomas said, COVID is it attacks society as a whole. And what we're seeing is a ruling elite across the world and their governments are pursuing that herd immunity policy in whatever form it is. And that includes obviously Victoria, New South Wales and the rest of the world. And no one is safe while it still exists. As we saw in Australia, it was down to 0 and then it came back with a vengeance. And I think the World Socialist website on the 31st of October published an article which summarised the efforts that have been made towards the webinar. And we went through some of, what is actually required to eliminate the virus. And it has to be seen in that way, that it has to be a struggle by the entire working class, not just a school or groups of schools or group of parents or group of teachers or whatever it is. Because even if that were successful for a very brief time, it would soon come back. There would be a return to epidemic proportions, which is why, it's such a transmissible disease. And we went through that the only effective strategy has to be global, and that, it means the repudiation of government policy and a coherent set of policies in its place. And we don't just see, a CO2 monitor or anything, they are part of that. But the very fact that there aren't school closures, which is what's required now, there is community transmission, there needs to be school closures, shows or points to the question as to why are the schools open if it's unsafe. The governments are well aware of, they know this science, but they are keeping them open because of economic, concerns of the elite, and they are opposed to a scientific perspective, and that's why there aren't monitors everywhere, because they don't want the unsafe conditions to be shown up. And trying to pressure the powers that be, the ones that are quite intent on seeing thousands and thousands of people and millions of people get COVID, is, as Lisa Diaz discovered, a very pointless exercise. So I think that we are based on as much as possible a scientific approach, and that requires the building of a movement. And as Thomas said, that the building of a movement is a difficult and complex task, and it is inevitable that parents, teachers and students have been swayed by the media campaign and the lack of any opposition by the unions and the social democratic parties. But that doesn't mean there isn't opposition and that it can't be built upon. That just means that we have to fight for our perspective to be heard and to win a hearing, and it will. We have to say what is, in other words.
Thanks a lot, Will. We are going to need to move towards concluding the discussion portion of this meeting. Please don't log off just yet, however. I do have some really important and brief announcements to make. But first, I'll throw it to Sue Phillips, CFPE National Convener, to make some concluding comments.
Yeah, thanks, Patrick. Sorry, Kieran, I can see Kieran has her hand up. But, you know, we shall keep in contact. And if you have a question or a comment, please put it in the chat. I think that is, thank you very much for everyone's contributions, whether it was actually speaking in the meeting or putting comments in the chat. You know, one can see there is enormous discussion taking place within the community and within the working class, and growing concern about how are we going to go forward and protect our children, students, educators, and the community. I think one of the things that has been revealed, and it was revealed in Thomas's contribution in talking about Lisa, is that she has gone through a number of processes and drawn through this process political lessons. And in our comments, I just want to refer to a couple of comments that were in the chat that I think were important, which kind of sum up, you know, the orientation and the struggle that we're taking forward. This is from Cheryl. She says, "It is apparent that the only way for change is an international surge by the working class by forming committees unfettered by useless unions and capitalist political parties. We are on our own." Now, we are not on our own. We are and we are not on our own, because what we stand with, what the CFPE stands with and the Socialist Equality Party stands with, is with the great mass of working people. Working people want a solution to these problems that they confront. They're seeking a solution and they're going through certain experiences. But what is clear is that unless ordinary people begin to take matters into their own hands, the development of independent committees and so on, then you know, there's no real way forward. That comment that Cheryl made is important, and then there was another one that followed straight after. I just want to read it. Thomas is correct. This was after Thomas's contribution, and hence the reason for this meeting, that the politics of pressure have been found to be a dead end time and again. Letting off steam might make you feel like you may have achieved, but we need to move away from that perspective. It's an important comment about rank and file committees. Now, one of the issues that, just finally, one of the issues that's come up by parents in the meeting and even teachers is that this feeling of isolation. And one of the reasons, and particularly for teachers, because teachers, all the comments that we've gathered in the last weeks from parents and teachers are anonymous. They're anonymous because, firstly, teachers fear that if they speak out, they could be victimised. And the reason they're fearful is because the union, the AEU, the New South Wales Teachers Federation, oppose teachers speaking out. They agree with the reopening of the schools, and they're in total agreement with gagging teachers. And parents feel worried because they feel like that if they speak out, they'll be targeted by the principal or whatever. So that, and that's one good reason that all of those people that are feeling isolated at this stage, that they join the Committee for Public Education. And as a group, we speak out and broaden what we're fighting for. And we know, as Thomas said, things don't stay the same. The situation is changing. And when Lisa Diaz spoke out, she won support not only within the UK, but internationally. There is international support for closing the schools. And so I think that that's very important. So we're calling on we thank everyone for their participation, in particular our speakers, Al and Thomas, who has got up early and stayed on to answer the questions. And we call on you to leave your details, join the CFPE, join a rank and file committee. That will be the most important step that you've made today, so we can continue the discussion, develop that opposition that is emerging and develop a political perspective to change this terrible situation that we're confronting internationally with COVID.
Thanks very much, Sue, and I'd like to add my voice of thanks to those people participating in the meeting today. Please make sure you do leave your details, follow us on social media, and of course read the World Socials website, which is the most widely read socials publication internationally. Every day we have reports from around the world on the situation with the pandemic and in the schools specifically, so I encourage you to follow that. Just before we wrap up, just some final announcements. Firstly is with regard to literature through Merring Books, which is a socialist book publisher who is supported by the Socialist Equality Party and the CFPE. The first book we're promoting today is the New York Times 1619 Project and the Racial Falsification of History. This is a book that collects the series of articles and interviews that we posted on the World Socials website in response to the New York Times 1619 Project. For those who don't know, it's essentially a series of articles posted in the New York Times which presented American history as a series of struggles between Black people and white people, completely obliterating the class divisions within American society, denouncing the American Revolution as being some sort of reactionary plot to maintain slavery against the best efforts of the British Empire to end it, supposedly. So this was a project that was bound up with a whole series of historical falsifications, and the World Socials website interviewed a whole series of really prominent, preeminent historians, as you can see there in the slide, including Gordon Wood, James McPherson. I won't read all those names, but major figures that spoke with the World Socials website, clarified the political and historical issues with the 1619 Project, and that intervention by the World Socials website really had an enormous impact and triggered a nationwide public debate within the United States on its revolutionary history and on the way in which race and class are understood both historically and politically. So I very much encourage you to buy that book. You can order it online, merring.com.au. That's $35 plus postage. We have a couple of other books that I'll quickly go through. This is a resolution that was adopted at the 6th National Congress of our sister party in the United States, the Socialist Equality Party. It's called The Global Pandemic, the Class Struggle and the Tasks of the SEP. That's a short pamphlet, just $5 plus postage. Again, as you can see there, detailing the analysis of our international movement, noting that the coronavirus pandemic is not some sort of accidental or incidental issue in world politics, but rather will go down in history as a major trigger event, a turning point that catalyzes all the contradictions of the global capitalist system and will trigger enormous political ructions for the years and decades to come. And finally, and importantly, this is a book by Vadim Rogovin, who's was a Soviet sociologist and historian. He wrote a series of books tracing historically the struggle waged by Leon Trotsky and the left opposition in the Soviet Union against the bureaucratic counter-revolution that was headed by Joseph Stalin. The volume that you can see there is Bolsheviks Against Stalinism, 1928 to 1933. It's $45 plus postage, or $13 the electronic version. That's a major publication exposing the lie that somehow Stalinism represented the continuation of the 1917 Russian Revolution. Of course, as socialists, we are very familiar with answering questions from working class people about what happened in the Soviet Union. Is this what we mean by socialism? So clarifying the historical record and really detailing the way in which Leon Trotsky and the left opposition fought for a genuine Marxist alternative to the reactionary program advanced by Stalin and the bureaucracy is really critical. We are having a public meeting, an international meeting tomorrow morning, our time. Again, featuring what you just saw there was I believe it's the second volume in Vadim's series. We're launching a new book, a new translation of the first book in the series, titled Was There an Alternative, which deals with the origins of the left opposition in 1923 and its struggle between 1923 and 1928. So this is a major international event, 9 AM Australian Eastern Time, which is a much more civilised time than previous international meetings we've held. So we'd encourage everyone here to register for that event and attend tomorrow morning. It's going to be chaired by David North, the international editor of the World Socialist website, and also featuring on the panel Andrea Peters, who's a Russian-American sociologist, and Joseph Scalise, who's a historian, expert on the history of Stalinism, particularly in East Asia. So the panel will be discussing Vadim's work and his book, and I believe there's also a generous discount for participants who wish to purchase that book. So very much encourage everyone to attend that meeting. I believe finally, I wish to make an announcement regarding the electoral membership. Yes, okay, so join the IOSSE, which is the International Youth and Students of Social Equality. If you're a student or young person, join the Socialist Equality Party. You can learn more about our party by purchasing the Statement of Principles, which provides a succinct summation of the principles and historical issues grounding the work of the SEP. And we wish to make a special appeal to everyone who isn't already to join as an electoral member. Recently, we've confronted a whole series of anti-democratic electoral laws that were rushed through the Australian Parliament in recent weeks. This was in spite of no genuine parliamentary debate, no public debate, minimal media coverage that was quickly dropped. In other words, behind the backs of the population, the Labor Party joined hands with the Liberal National Coalition government to ram new laws through, which mean that in order to stand for Parliament and to have one's party name identified on the ballot, recognising people's basic democratic right to know who they potentially can vote for, that is now a privilege preserved for political parties that can comply with new regulations. One of the regulations includes a stipulation that the party seeking to contest an election must submit to the Australian Electoral Commission 1,500 names and personal contact information of their members. And that's an increase from the previous requirement of 500 names. So the Socialist Equality Party is a federally registered party, which means that we're able to stand for parliamentary elections, identifying clearly our candidates as being members of the Socialist Equality Party. That is now in danger, that is now at risk as a result of these really anti-democratic laws that have been rushed through. We've been given 90 days. We've been given 90 days in conditions of the pandemic, as we've been discussing, to increase the number of submitted member names from 500 to 1,500. That is a requirement that only applies to those political parties that do not have members of parliament already present. In other words, the Liberal, Labor Party, Greens, they don't have to do this. It's only the Socialist Equality Party, excuse me, and other parties who are not currently represented in Parliament who have to comply with this edict. And now this is not some sort of aberration or mistake. This is the Australian ruling class seeking to crack down on democratic rights, seeking to block any challenge to the two-party system, and above all, seeking to exclude the Socialist Equality Party from democratic discussion in Australia, from being able to stand in elections before the working class here, clearly identifying ourselves as socialists. How are we going to oppose this? Well, we've been launching we had launched and have been pursuing a very vigorous public campaign, encouraging people to join the fight to defeat these electoral laws. And you can defeat them by joining the SEP. Become an electoral member. You will help us then get to that 1,500 quota that the Australian Electoral Commission requires. In order to become an electoral member, you do need to be an Australian citizen, and you need to be either on the electoral roll or able to get on the electoral roll in the next period. So please contact us if you're willing and able to do that. It would be a really important concrete step everyone here could take to support the work of our party and of our movement going forward. Thank you very much again, everybody, for your attendance. I just encourage everybody to leave your contact details if you haven't already leave any final messages in the chat box if you wish to. Please read the World Socials website. It's wsws.org. And hopefully we'll see some of you in attendance tomorrow morning at 9 AM for the book launch of the new volume of the Van Rogovan translation. Thanks very much. Bye-bye.